All right. Good morning, everyone, or afternoon, or evening, wherever you may be. I'm Michelle Stewart. I'm here to kind of kick us off on our virtual session here. So it's live, so of course everything happens, so please bear with us. I just have to say before we kick it off that I am so excited to hear from our speakers today. I have had the pleasure of getting to know them the past few months, and it's just, you're in for a treat is all I have to say. So our session here is Trans Community, Disproportionate Impact of Health, Wellbeing, and Equality. And I'm going to go ahead and have our speakers go ahead and introduce themselves. We'll go ahead and start with Tori.
Good afternoon, good morning, all that other wonderful stuff. My name is Tori Cooper. By day, I'm the Director of Communications. I gave myself the wrong title. By day, I'm the Director of Community Engagement at the Human Rights Campaign. I'm also a health and equity consultant. My pronouns are she, her, and hers, and I'm super excited to be here today.
All right, Tony.
Hi, I'm Tony Barrington. I'm an IT category specialist at Chevron. I'm also the Houston Pride L&D co-lead. My pronouns are she, her, and hers, and I'm here to share my perspective, and just glad to be here sharing this summit, sharing in this session and at the summit. Thank you.
All right, Javon.
Hi, I'm Javon Martin. I am the founder and executive director of Princess Janae Place in New York, and it was a pleasure to be a part of this project.
All right, Mike.
Yeah, hello. So it's first just want to say it's a privilege to be here, certainly with these esteemed panelists that we have, and you know, I participated in this conference in the past and attended and presented before. So I'm currently the team lead for global public health. In this position, get to work closely with our health partnerships. So that's both internally and externally, like our diversity and inclusion collaboration, our Pride Network partnerships, as well as many of our external partners like the National AIDS Memorial. So we focus a lot on workforce and community health issues, global health security, equity, and prosperity, among other more disease prevention initiatives. So thanks for joining us today and participating during this session.
And John.
Hi, my name is John Cunningham, he, him. I'm the executive director of the National AIDS Memorial. I first want to express, my deep and sincere appreciation to Out and Equal for the decades-long work that Out and Equal has done to improve the workplace and make it a safer, more accepting space for LGBTQ individuals. I've had the opportunity over the years to attend many a conference, and I know that I've heard that this has really been a great dynamic week so far. As I said, I'm the executive director of the National AIDS Memorial. I'm also a man that has been living with AIDS for 25 years. I was a community organizer in the heart of the Castro district in San Francisco in the 80s, and have along that way and along that journey evolved to step into leadership roles within AIDS-related organizations. And what we're going to do with you today is foundational to the organization, and we couldn't do it without our partnership with Chevron. And I'll tell you a little bit more about both the project and the partnership. So I want to thank everybody for being here today.
Thank you all. So I'm Michelle Stewart. Again, I'm the president of our Global Pride Employee Network at Chevron. My pronouns are she, her, and we're going to kind of guide you through a journey today. So we're going to start by kind of talking about, why is Chevron here? And then we're going to move into a bit of the importance of the trans community and really having an awareness of some of the barriers and the challenges so that you can walk away today knowing what you need to do, what your company needs to do, and what your employee network needs to do to help empower this community. So that is our goal and our focus today. And we're going to have an opportunity for you to ask some questions in the Q&A. And so we're just really excited to get this started. So with that, I'm going to have Mike go ahead and kick us off.
Okay, thanks, Michelle. So as Michelle said, I'm going to share a little bit about, what are we doing here? We're a global energy company, and why are we here? And then I'll share a few other points as well. So first about, what we are. We're a global energy company, 140 plus years old. Our headquarters are currently in San Ramon, California. So that's about an hour east of San Francisco. And we've been one of the top 25 largest employers in California, and definitely contribute significantly to the economies where we operate globally. So we're constantly working to provide reliable, affordable, and ever cleaner energy globally. So we employ hundreds of thousands of people, and we have specific expectations for our workforce, as well as our partners and vendors we contract with around key issues like diversity, equity, non-discrimination agreements, just to name a few. So we also have specific focus on STEM, which is science, technology, engineering, and math, and these initiatives that focus on building capacity for the next generation workforce. So with diversity and inclusion, as well as health and safety, these are embedded in our operations and in our values. So we know that hiring and retaining individuals with an array of talents and ideas and experiences really propels the innovation that drives our success, in our fence and outside of our fence. So we're proud, I'm going to share a few points here. We're really proud of being the first major integrated energy company to offer domestic partner benefits to employees, fully implement trans-inclusive healthcare benefits, include sexual orientation and its non-discriminatory policies. And very proudly, Chevron earned its 15th perfect score for LGBT equality as recognized by the Corporate Equality Index. But we know we have a lot more work to do. And there are people like us here who are really continuing to drive that work for change in our company and advocate with our partners. So I think, we're here to learn and share during this conference and beyond the conference. This is one common theme, I think, that binds us all here today and during this week and during this amazing conference. So I think, your role within your organizations can be, to educate and promote and advocate and engage to drive these types of changes, just as we're doing here, and we're going to be sharing some of those. I'm also just proud to work for this company. I'm going to share a couple of other did you knows. So we were the first energy company with an HIV/AIDS policy. We won the 2019 Best Places to Work for People with Disabilities. We've got a really strong volunteer program here. In 2019, logged over 193,000 volunteer hours in the United States. And that's one thing I'd say, if your companies have volunteer programs, it's really such a powerful way to support internal and external stakeholders, and ultimately those in need of critical support services. So I encourage everyone to link to your programs and efforts and select community partners that are best fits for your organization, and make sure that you have those discussions around aligning goals and expectations. You can move on to the next slide. So a few other points I wanted to mention about our employee networks, like our Pride Network. So in 2019, almost 20,000 of our employees, that's nearly 45% of our regular workforce, participated in Chevron employee networks that celebrate and promote diversity, really. Again, I really encourage people to get involved if they have those networks, or develop some if their companies don't have those. Top 30 American companies for diversity. It was 2018 Best of Best Corporations for Inclusion. And Chevron achieved the EDGE Move certification level, placing amongst the top 14 of 200 global companies receiving EDGE certification for gender equality. So we're super proud of that. And something that I was really proud and happy to see the last couple of years, at our company headquarters, we raised the Pride flag during Pride Month, and also at a lot of our other company locations. So this, engaging leadership at all levels, I think, in your organizations, and developing meaningful, visible messaging and opportunities to highlight inclusivity, I think are well worth the efforts. And it was really exciting to see that happen very visibly at our company the last couple of years. You can change to the next slide. Go next slide, Michelle. Great. So we don't do any of this work without partners. So that's internal and externally, but partnerships are really a key Chevron value. And we engage in cross-functional, cross-sectoral, and organizational partnerships. Again, aligning with shared goals in an impact and outcomes focused approach. So one longtime partnership continues to evolve with the National AIDS Memorial. So it's not just a beautiful, magical memorial space in Golden Gate Park, San Francisco. Their work in preservation and advocacy and educating are really critical tools for enabling human rights, health justice, and equity for generations to come. And their programs touch countless lives and create opportunities for shared prosperity. So one program we've been really proud to sponsor for many years now is the Surviving Voices Project. You'll hear about that in a moment, but I can say every time I watch one of these stories, it just really grounds me in the value of listening, being compassionate and supportive of everybody. So I'd say that working with the right community partners can be very powerful, and the multi-directional learning, resource allocation, networking, and programming can be impactful in so many ways. And I think that's one way we can all work within our organizations and with our partnerships. So I think thanks for joining us today. So I'm now going to pass the mic on to John Cunningham, Executive Director of the National AIDS Memorial.
Thank you, Mike. You know, this is a really great opportunity. What I'd like to do is, first, I'd like to start off and give a little bit of overview of the National AIDS Memorial, who we are, how we came to be, and where we are headed. The National AIDS Memorial has been in existence for almost 30 years, was founded as a local memorial in San Francisco's Golden Gate Park at a time during the darkest days of the epidemic when so many were being lost in major cities and major metropolitan areas. It's a living memorial. It's 10.5 acres. It was created by the community for the community and continues to be maintained with the community's support. At that same time, there was also another project going on in San Francisco that was just a few miles away that was started, and that was the AIDS Memorial Quilt, the NAMES project. I'm pleased to say that this last year, the National AIDS Memorial was honored to accept and to be the steward of the quilt. And so these two amazing projects that started in San Francisco, the quilt went down to Atlanta for about 19 years. And we brought it back on 7 rail cars last year, 52 tons, over 100,000 individuals memorialized. It's the largest community art creation ever made. And it is also perhaps one of the greatest social justice and activist teaching tools. So bringing the power of those two comes together, and it came together in a very, very serendipitous way. This organization realizes that the underlying and underpinning story of the HIV and AIDS crisis is rooted in stigma and discrimination, prejudice, marginalization, and otherism. It also is rooted in compassion, love, activism, strength, support, and community. That is the purpose of a memorial. A memorial is more for those that follow all of us than it is for those that lived through it at the time. I think it's interesting to think about the fact that the National AIDS Memorial and the AIDS Memorial Quilt, unlike most any memorial we've been able to research and find. So it was created in the middle of the pandemic. It was in the middle of what you're memorializing. Every memorial we have found has been after. And there's power in that because it was created by the hands of those that were grieving and those that were being lost. It was actually the panels, so many panels for the quilt were actually sewn by individuals who were dying. And those quilt panels ended up being sewn together. Some memorials have a profound importance to society, like Holocaust and others that are telling a societal story that can send lessons and messages and historical perspective to the future so that those that follow will learn from what had gone on in the past. You know, this is a virus. The HIV and AIDS is a virus. It is not a lifestyle. It was not, it was not because one injects drugs. It was not because one is a sex worker. It is not because one is gay. It is not because one is trans. It is a virus. And to stigmatize a virus is one of the most undermining and just absolutely critical underminings of public health. Unfortunately, we're all living through it again right now. So the National AIDS Memorial takes its role to ensure that the stories of social justice and human rights and health justice and access and systemic barriers to health outcomes are critical at the forefront. Memorials are about memory, and memory is about storytelling. And how do we keep the memories of those loved ones alive? We tell their stories, and that's what a memorial is about. So nearly 10 years ago, we started the Surviving Voices Oral History Project, which has focused the camera on different populations in different communities and began the process of capturing those oral histories. You know, as a gay man, I would never want anybody else to try to tell my story who's not a gay man. So we work very, very closely with the community that we're focusing the camera on. And as I said before, Javon last year was one of our advisors that helped us to identify who would be the focus and the key individuals, those voices that were important, and what the storyline would be. Over the years, we've pointed the camera on such communities as the leather community, the hemophilia community, women and AIDS, the Asian Pacific Islander community. Last year was the trans community. And right now we're in the middle of shooting those that use substances and those in recovery. As you can see, we're also focusing the camera on communities that need to have the feeling of being seen, because so many of these communities are not seen. And if we can empower those individuals and those communities by pointing the camera and saying, we want to hear from you, it will build pride and esteem in the community. And as a result of that pride, welcome, Javon. As a result of that pride and esteem, it will help individuals to make healthy decisions regarding their own health outcomes. So last year, we focused the camera on the trans community. Our producer traveled the country up and down, shooting individuals from around the country on the various stories. It was one of the most powerful Surviving Voices episodes that we've ever done, and it premiered on World AIDS Day in the National AIDS Memorial, but also it premiered in New York, London, Berlin, Amsterdam, Honolulu, Los Angeles. And it continues to be used as a teaching tool for individuals in organizations, by employers and other communities. I avail that to you as individuals that represent employers, that if you have a need or would like to access any of our Surviving Voices, they're there for you, they're there for the community. So as we look to the future, it is our commitment to continue to capture the stories, because it is those stories that we share with the world that will help to bring life to this, and that will help to inform generations that follow us on the importance that we have as citizens. Lastly, before I introduce the video, of course, as we live through COVID right now, we will not be having our gathering for World AIDS Day, but we will be having a virtual conference. And I just want to briefly put it out there to all of you in the hope that you and your community and your employee network may want to join. You can visit aidsmemorial.org. And this year we're focusing with 3 different tracks. One track will be focused on science and medicine. And we're honored that Dr. Anthony Fauci and that Dr. David Ho will be our keynote speakers for that track. The second track will be focusing on systemic barriers to health outcomes in marginalized populations and communities of color. And we're right now in the process of confirming the mayor of Atlanta, the mayor of Washington, D.C., the mayor of Long Beach, and it'll be facilitated by a leading public health official. And then the last one will be focused on activism and how activism can bring about powerful, positive impacts to our community. So again, this will be on December 1st, World AIDS Day. It will start at 10 a.m. Pacific time, 1 p.m. East Coast. And you can get more information about it. It's free of charge. You get more information at aidsmemorial.org. So what we're going to do now is we're going to premiere for you what premiered around the world last year, and what brought us to this table. And what, again, I want to do is to thank Chevron for their longstanding support. And I can tell you, I have long been an individual that it's all about partnerships and it's all about shared values. And it's all about being in partnership with individuals and with entities that walk the walk. And I can tell you that Chevron has been such a supportive company over the years. They were one of the very first companies to step into the HIV and AIDS crisis some nearly 35 to 37 years ago. So without any further ado, Michelle, why don't you hit play and let's watch the surviving voices.
All of the media messaging about HIV is that it's a manageable illness. I think trans folks living with HIV are still living a completely different reality.
So many of the issues that we faced in the 80s, we continue to face.
We are where the country was 30 years ago.
The day I got my diagnosis,
I tested positive in September 26, 2008.
Right before my 28th birthday.
at the time, I was given 5 years to live.
I left without an offer of continuing care, an offer for case management, an offer for anything.
There wasn't any place for us to go. Everything was predominantly gay support groups or trans women support groups.
It felt like an incredibly isolating experience in different ways.
I thought I was going to be the next one to die.
My thought is, well, if I've only got 3 months to live, I might as well just keep drugging. After like 4 years, I figured I wasn't going nowhere.
I went to the doctor and I got my medicine and I started trying to take care of myself. That day, I rose from the dead.
Back in the day, in the 80s and the 90s, there was never good data collection on trans folks.
There was so much more data around injection drug users, gay men who have sex with men.
People were not even recognized as existing, let alone being at risk for HIV/AIDS. It wasn't until 1996 that the San Francisco Department of Public Health was able to start doing research to get some solid data.
The ways that data has been reported has been really inaccurate. And with trans men, there's just almost no counting us at this point in time.
When we look at more recent, the small data sets that are available, more than 1 out of 2 Black trans women are going to contract HIV during our lifetimes.
1 out of 3 trans Latina women is HIV positive.
Miami and Fort Lauderdale, they are the first and the second place in new infections in HIV nationwide.
We're seeing that with Black trans women, we still are dying at earlier rates.
I think it's important that we understand the social factors that contribute for trans people, and particularly trans women of color, to become infected.
The ways the epidemic and gender, race, class are colliding. Trans folks are sort of at the nexus of a number of systems of oppression.
Anyone that lives outside of like gender norms are more likely to experience violence on that level.
Hate violence and discrimination and police harassment, lack of family acceptance, lack of societal acceptance, difficulty getting an education, difficulty getting culturally competent health care.
It can be extremely difficult for a person of transgender experience to receive health care in Alabama. Many doctors are afraid of the stigma that will fall on them if they treat transgender community.
There's still a lot of ignorance in the healthcare. Me personally, don't feel comfortable revealing that I'm trans to when I go to my primary care or if I'm in a hospital.
Imagine me going to one medical doctor to concerning about my hair and see people who working over there laughing on me and think my health is ridiculous.
For many trans feminine folks in particular, there's such rampant employment discrimination.
I couldn't even go at McDonald's and get a job.
They're looking at your application and looking at you and laughing and then throwing it in the trash can in your face.
If I can't get a job, I still got to feed myself. I still got to have a place to stay.
And I had to do like transactional sex work to make money to survive.
Most folks who are engaged in sex work, they are doing it because it's something that validates them and empowers them, and we need to respect that.
Trans men actually engage in monetary sex work as well as our sisters, and we just don't talk about it.
A lot of us are survivors of child molestation, so we don't feel that we have agency over our bodies.
I transitioned in my 30s, right? And so I had, I'm 52, so I was raised with a particular version of girlhood.
I was taught that, it's better to be seen, not heard.
And I know that stuff also leaves me incredibly vulnerable to sexual coercion, sexual assault, right?
The need to be accepted is so compelling in transgender women's life that a lot of times it is more important than the health. If a John says that they'll give you $100 extra if you don't use protection, and you have to put food on the table, what would your decision be?
Many members of the trans community have a criminal record already. A lot of it could be related to survival crimes in the past.
I was using heavy drugs. I was, doing sex work, and as a result, I ended up in the correctional system.
Things like sex still goes on in jails. Girls like me become very popular when we come to jail. And for somebody who's done sex work, it becomes second nature. So we do what we do in order to survive.
Being transgender in prison drastically increases your chance of contracting HIV. You have no access to prophylactics or anything else to protect you.
I was a trans woman on hormone therapy while incarcerated, but yet they placed me in a facility with men while I was sexually abused almost daily.
I'm not talking about just by the inmates, I'm talking about by the officers as well.
But while I was in there, I filed a lawsuit against the Georgia Department of Correction. They failed to protect me, and there I fell in love with law. I realized that this is a tool to combat oppression.
The community can be dealing with HIV. It doesn't mean that you always have to be in the role of a victim.
I wanted to do the work and advocate for people like me living with HIV.
And another thing is you can't have anything trans without involving trans.
We don't need you to save us. What we need you to do is to create the space and let us save ourselves.
It's our experience. We know how to combat these systems because we've lived it.
Marsha P. Johnson and Sylvia Rivera in 1970, they created the Star House, and it was a place that transvestites, which is the term that was used, the transvestites who were homeless could come and stay there. And so as a person who works in public health, I often hear, well, we don't know how to get trans women off the street, so we don't know where to place them. Well, 49 years ago, two hookers and whores in New York City figured out how to do it, but yet we can't figure out how to do it in a major city like Atlanta. It is important for the system to trust us to take care of ourselves because we've been doing it all along anyway.
A lot of the issues that we're dealing with are not going to be resolved by simply HIV testing and passing out condoms. There has to be an understanding of how historical trauma has impacted our community and how that shows up in how we we have agency over our bodies. Too often what organizations do is say, well, we're not going to give you hormones or testosterone shots if you don't adhere to an HIV regimen.
If you don't have anything to live for, and if you're not comfortable in your own body, like, why bother?
And you're not going to have a lot of success in retaining trans women and trans men who are seeking services.
I made the decision to transition in 2002. I had 33 T cells and a viral load off the chart because, I didn't have anything to live for, right? So why was I going to tolerate side effects when I couldn't envision myself in a future as an old woman? So I actually made the decision to transition sort of as a death gift to myself. And lo and behold, like, when you like yourself, it gets easier to fight for a future that you can see yourself in.
As trans people, we've come a long way in the last 30-some years. But we still have so far to go. I want to see the day when everyone is celebrated for being their true self. When we say, this is who I am. And people say, yeah, be yourself. Be who you are.
Oh boy. Let's just take a minute, because I've seen this a lot. I was in the middle of it, and I got to tell you that as looking at the chats, I'm as emotional as many of you. There is so much inspiration that can be gained, that is gained from the courage and the strength and the power of this community. As has been in the chat, you can visit our website. You can look at this short one, but this short one is made of 17 deep dive oral histories that range between 10 and 17 minutes each. And those deep dives go really deep into the individual's life and their history and their story. And as I said, it also goes beyond. It goes to the API community. It goes to women in AIDS. It goes to the hemophilia community, the tragedy that befell them. It goes to the leather community. And it really shows that we all have our own struggle in the world. We all walk a same journey. And if ever there's a time when we can use this kind of inspiration and courage of individuals standing up and saying, this is who I am, and I'm not asking you for anything, because I stand knowing who I am, and it doesn't matter what you think. There's such power. So I want to thank, again, you saw Tori, and I want to thank Javon for being one of our advisors in this process. And again, I also want to thank Chevron for helping to make this happen. And as I said, right now we're in the middle of shooting another powerful one this year, which is focusing on individuals that use substance and those that are in recovery. And you can just well imagine that's going to be another incredibly powerful process. If any of you out there are interested in learning more about how you can become involved in this, as a nonprofit, I would be remiss if I didn't say, if your company is interested in partnering with us and with Chevron to continue to make sure that these dynamic stories are shared, please feel free to reach out to me. And again, this is your story. This is your product. You can have it. Please use it. If you want anything from us that will help you in your workforce to make sure you open up the conversations that need to be had, make people be vulnerable, because that's where the healing happens and that's where the growth happens. So without that, I will then turn it back over.
Thank you, John. Again, such a powerful series of stories. And I'm looking forward now to hearing a little bit more of deep diving into some of those topics. And so I'm going to kick it off with our Ms. Tori Cooper, and she'll get us going into learning a little bit more about some of those experiences. Let me share my screen here.
So good afternoon again, everyone. And let me say, John and Javon, that was absolutely amazing. I took part in it, and I don't think I've ever seen the finished product that we just saw, and so that was really powerful. I'm so thankful to have an opportunity. I've come to this section and walk through life with a lot of privilege, but every single word that you heard and a million more highlight much of the difficulty that we as trans folks have to live with and navigate. Okay. So did you all hear breakup? Was that a thing? Okay. All right. So I'll talk a little bit about myself. I guess I have about 2 or 3 minutes, and I'll talk a bit about myself. I think it's important when talking to really engage people that we speak from I, you, and we perspective, or I, we, and you. And so I'll talk a little bit about myself, and then I'll talk a little bit about we, which is folks like myself. And then in my 5 minutes or however long I have to talk, I also give folks an action statement before we go into something that folks who are not like me or who are not part of the trans community or part of the Black trans community, some things that we can all do. I'd like to talk a bit about my trans experience. Every person's trans experience is unique to themselves. And there are many of us as trans folks who have similar experiences, but all of our experiences are different. And that's just like anybody else. It is in part because we come from different families, we're raised in different zip codes, and yet, much like our cisgender counterparts, our lives can be very, very similar to yours. Kia, because I know so many of the folks in the video, I can call folks by name, but Kiara mentioned the high rates of child abuse. And that is unfortunately something that happens across the LGBTQ spectrum, but also with our heterosexual and cisgender counterparts as well. Child abuse is something. I want to make sure that we're not tying in child abuse specifically with our trans experience, because those are entirely different. But unfortunately, it is something that many of us have faced in our lifetimes. So my trans experience, I began medical transition in 1993. I'm over 50 now. And so when I first started, I tell this story, and it's true. I used to order stuff, and I had good health insurance. I worked for Federated Department Stores in New York, and really good insurance, but I just didn't have the verbiage to tell my doctor that I was a woman. And so I used to have to order the stuff that I thought were hormones from the back of dirty magazines. And there were for those of us who are over a certain age, there were these 800 numbers, and you could call and you can get your astrology. You could call and you could find love or some type of connection. And you could also order things that were billed as gender hormones. And so I remember ordering those. And for folks who are my age and older, and even some who are younger, it just goes to show that even with all of us, most of us in life carry some type of privilege. And that even as trans folks, prior to medical transition or physical transition or expressions, it's important to understand that that feeling is there, that you know what your true identity is, even when you don't have words for it. And it's valid, just like our cisgender counterparts know that they're a man or a woman or something else. We as trans people, we know who we are. Some of us come to that conclusion a little later. Some of us come a bit early in life, but we know who we are, and that's really, really important. Hormonal therapy is something that was really, really important to me. Here's an I statement in my physical journey, and for many folks who are also part of the same community. And then there are folks who simply choose not to make physical adjustments, who choose either or don't have access to medical hormonal therapy or medical interventions. And then there's some who choose to have physical or surgical interventions. And all of those things, it's important to understand, are as necessary for some of us as food and water. It is essential. It is absolutely essential in order to have life for some people to have gender affirming interventions, whether that's medical, whether it is surgical, whether it is injections, whatever it is. But for some of us, that's extremely important. And here's a you statement. For those who do not identify under this trans umbrella, it is important to understand that our identity as men, woman, or something else is so vitally important and necessary. And that for some of us, we're going to do whatever's necessary so that our minds and our body more closely align. And so for all of our allies, make sure that in all of the work that you're doing, that you are encouraging policy that promotes that type of affirmation. Making sure that when there are policies that are anti-trans or not considerate of trans identities, that you speak up and make sure that those policies then become inclusive of trans people. So as trans folks, so there will be statistics that you will read, and unfortunately, as you heard in the video, there's not enough trans data. We can all agree on that. But even in trans data, it is quite often, I have a public health background, and quite often in public health spaces, we know that for a number of years, trans folks, particularly trans women, were lumped in together with MSM, which is men who have sex with men. And when we talk about risk categories from a public health standpoint, that's inappropriate because in part of who our sexual partners are and who our sexual networks are. And then more recently, we're seeing trans people of color all lumped in together. All right, that's also inappropriate. I make sure that folks understand that I'm a Black trans woman. And the reason why that distinction is necessary, certainly from a cultural standpoint, but when you look at, when you use terms like people of color, or BIPOC, which is Black and Indigenous people of color. When we specifically look at people of color, what we're doing from a public health standpoint or from whatever standpoint is we're lumping every person who's not white in together. And that's inappropriate. It's inappropriate from a public health standpoint because what we're saying is folks who are Black probably have the same amount of risk as folks who are Asian, because Asian folks are not white. We're saying that me as a Black trans woman who's 50 years old, sexually active and lives in the South has the same level of risk as an Asian woman who live risk for HIV and other health disparities as an Asian woman who lives in San Francisco. That's never appropriate. And so we have to make sure that we are understanding that trans people of color is a really, really lazy way to identify everybody that's not white. And we have to make sure that from a public health standpoint, that if we're identifying risk, if we're talking about morbidity, if we're talking about social disparity, that Black people have a much more difficult time navigating all of these systems than everybody else. And in part, it's because these systems weren't built for us. All right, our society was built on a bunch of different systems that were created by and for the benefit of white, cisgender, heterosexual men of a certain socio and economic status of a certain age, period. And the further you are away from that fake archetype of perfection, the more difficult you're going to have navigating society and all of the systems. Banking was created by white men who are cisgender, heterosexual, of a certain socioeconomic status for themselves. Mortgages, credit, all of those things, educational institutions. And so as trans people, and more specifically as Black trans people, it is because those systems weren't built for us and were actually built without us in mind, that we have more difficult time navigating those. I know my time is running short. So barriers. You hear me talking about systems, and today we're going to talk quite a bit about systems. Healthcare is a system. When we go to our doctor's office, for those of us who have some type of insurance, which again comes with a certain level of privilege, and we know as trans people, and more specifically as Black trans people and trans people of color, we have less access to insurance. So we know that healthcare itself is a barrier, and there are a whole bunch of other barriers as well. Unemployment is a barrier. Education is a barrier. Racism is a barrier, which I'm going to talk about last in my little section. But we know we talk about healthcare, we talk about many of the challenges that come with healthcare, that how important important it is. As a Black trans woman, again, over 50, certainly I need all of I may need gynecological care. However, I also need a prostate exam. And so when we have healthcare systems where the insurer has much more power than the medical provider, then that's a barrier. And it's not just a barrier for trans people, but it is something that impacts the lives of trans people so much more than many other communities, and that's important. If a doctor says you need a test, then a healthcare company should not be able to tell the insurance provider, no, we're not going to do it, particularly if you pay a premium. We're going to talk more about that in some of the other sections, but those are barriers. And even accessing healthcare, accessing employment, all of these are barriers that trans people are facing at incredibly high and disproportionate rates compared to our non-trans allies. We could talk about lower educational levels. And part of that, and there's so many reasons for that, but if we think of where racism and these systemic barriers start, if they start in school where kids are bullied for being different or for being feminine, considered feminine when they shouldn't be, or considered masculine when they shouldn't be, then all of this, it generally doesn't stop. What happens is as you get older and continue to go through school, unfortunately, those things build and they escalate. And so it makes it much more difficult for trans folks, binary kids, and for all kinds of other folks to get through school. And so that lowers folks, it creates additional systems and create additional barriers for trans people in particular to get education, and particularly higher education. And so there are many, many things there. We can talk about more of that later. And so systemic racism. So I don't know if you all can see my screensaver, but it says something like, if you're sick of hearing about racism, imagine how tired we are of talking about it. That's true. That's true. Systemic racism exists. And for any person to say that it doesn't, you're either dumb, you're stupid, I'm not going to make fun of deaf people, but either you can't hear or you simply refuse to. Racism exists, and it exists in every single system. It exists at Chevron. It exists in all places of employment. We were having a conversation yesterday, many of the folks on the call, and just looking at people's faces, there was someone who said, well, they've been with the company for a certain number of years, and the comment that I made is, based on the 9 people that are on the call, just a few years ago, at least 7 of us, based on our appearance and our names alone, wouldn't have been able to work at Chevron. 7, and that was because 2 of us were Black. I think 3 of us were female identified, 2 were Asian, and and so on. And then there were a couple of folks who had names that were Hispanic sounding names. It exists. It exists. And so racism is one of the most disgusting forms, things that any of us will have to deal with. And for any of us to think that it doesn't exist and it doesn't impact the lives of trans people, because you might not realize, if I'm at the grocery store picking up cantaloupe, you might not realize I'm trans. However, you still see that I'm a Black woman, and you might be fine with the fact that I'm trans, but you might hate Black people. And that happens in society. And so it's so very, very important that we understand you cannot separate a person from all of the identities and all of the communities that they represent. And that's especially important for trans people, because some of us will get love for being Black and get scorned and hated on because of our trans identities. So, so that's it for now, because we're going to talk more. But I would love, I think Michelle is coming on next, I believe.
I'm just going to say clap, clap, Tori. I mean, people are loving to hear what you say. You're speaking truth, you're being candid, and that's what we need. We need to, take off the gloves and let's have these conversations. And so just really awesome. And I hope people understand how excited I am to have you all here. So what I want to do is kick it off to Javon and have him speak a bit about the experiences that he's seen and experienced, and we'll continue to dive into these topics.
Well, thank you so much. Talking behind Tori. Oh my goodness. Okay, I should have went first, right? But this is needed, and I'm glad to see the response from all of the participants. I've been on the chat, and this is how we get rid of what's happening right now within the uh, world, right? Education. We educate, we use this video as a tool so that people will understand who we are, what we want, what we need as human beings, right? And homelessness is affecting everyone. And more so right now during this pandemic, homelessness is one of the areas where we need the most help, assistance. It just, the homeless population cannot quarantine because they have nowhere to go. So at Princess Janae Place here in New York, we're out in the street making sure the homeless people have their PPE, making sure they have water. We're putting people in hotels and motels, and I have kids, right? So I'm like scared that I'm going to, infect my kids, but at the same time I have a job to do. And we're relocating people. New York is trying to stay up and keep it together during this time, but homelessness for the trans community looks different than from the cis hetero community, because when we go to get an application from the realtor office, right? They look at us and they say they don't have any apartments available. And so why? Like online, there was an apartment. Now when I get here, all of a sudden it's been rented. Or when I call, oh yeah, we have apartments, come on in, fill out the application. And then when a trans person shows up, oh, we rented them. So what Princess Janae Place does is we come in and we filter that. We'll talk to the realtor, we'll talk to the landlord, and we'll see if they have an apartment available. We'll talk to the client and we'll let them know, hey, there's an apartment, and we pay first month rent and security to hold that apartment. Then the person goes in. There's no way you can't say that there's no apartment because we already got the apartment. We put the person in the apartment and we, monitor them, just calling, checking on them for about 2-3 months to make sure that they're okay. That's what the community needs. We don't need you to monitor people for a whole year, right? If you don't have a lease in your name, you're homeless. This is what we've been letting everyone know, because at any given time, you can be put out. If you're living with your girlfriend, your mother, your father, your cousins and them, and your name is not on that lease, you're homeless. We do our best to house everyone, because when we go to your store, we don't want you to discriminate against us. So if you are homeless and you come to PJP, we'll house you and we'll help you, whatever we can do, help you get a voucher, help you get an apartment. That's what we do. Challenges with employment, Tori touched on that. Tori actually touched on all this. The video touched on every single thing here, right? But the challenges with employment is what Kiara said. When we show up to a job interview and they look at us, I'm sorry, that position has been filled. Meanwhile, it's still online, right? And these things happen because of racism, right? Discrimination, right? As a Black man, I've been discriminated against from my own people, right? Because I'm not Black enough, right? And then there's sometimes I am too Black, whatever that means. At the end of the day, for me, we're all human and we're all deserving of housing and employment and health care, right? Just because we breathe. But also with employment, we have, as the trans community, some barriers with employment. A lot of the trans people here don't have, I'm going to say, proper clothing, right, to go and interview for a job, right? And I said proper because some businesses, they want you to come in a suit and tie. You know, some trans men, and when they're in their transition, they don't know what size they wear. You know, they're still coming into themselves. And, you know, I've been struggling for years trying to figure out how the suit fit and how to, you know, put a tie on correctly. That's why I don't have one on today, because it would have been crooked, right? But there are things that we struggle with. And I really don't want to talk too much on the trans women in their clothing and dressing, but I just want to say that we need, you know, support in these areas when going to job interviews, and don't critique, you know, too much if someone's clothes is a little bit too big or you know, a little too tight, right? Because just be happy that we showed up. Because some trans people in the morning, they don't even get out of bed because they don't want to face the person that they're seeing in the mirror because it does not reflect who they are. But they know they need a job because they have to pay bills and they have to eat. So just work with us, right? Which ties into transitioning, right? A lot of people feel though we transition because we're not comfortable, right? People transition for different reasons. Everyone's transition is individual, right? And I'm gonna keep it on me, as Tori says, we keep it on I, we, and me. And I lived my life as a full-grown woman. I didn't transition until my 30s, medically. I had a daughter, and she'll be 30 soon, and I have grandkids, and they see me as Papa, right? As a male. My daughter saw me as her mom, right? I had no problems with being a female, none whatsoever. I lived my life as a full woman, a lesbian, because that's all I knew. I only knew of trans women. I didn't know trans men existed. Once I found out that trans men existed, or that I could transition to a man, to be a man, because I felt masculine, I started that process. And all of my lesbian friends, why would you do that? Why would you want to be a man? You're fine who you are. But I wasn't comfortable. I was tall, big, huge hands, huge feet. I wear 13 men's, 13 shoe. I wasn't comfortable, right? So I transitioned for me, and now I'm comfortable. And it was more so of who I already was, right? I was a tomboy, but I just didn't know that I was transitioning to someone that was going to be a threat to society. Because as a Black man, I am a threat. Just for existing, just for breathing and walking while Black, I am a threat. And I didn't know that. I know that now. So with that, I'm careful with how I talk to people. I'm careful before I go hug someone, and I'm careful before I, you know, smile at children and pick up children, because I'm perceived to be a threat. Which ties into the man and woman culture, right? Cis hetero norms. We need to get rid of that altogether, right? The whole male, female, and just we're all people. If you go to other countries and you have to use the restroom, because I've been to several countries. I have had the privilege to travel to other countries, and it just says restroom. And when you go in the restroom, there's stalls, and you close the doors. It didn't say women or men. You all go to the bathroom, you come out, and everyone washes their hands together, and everyone goes about their business, right? There's no, oh, I'm worried that I'm going to get raped, or trans people go to the bathroom to use the bathroom. And I know when I go to the bathroom, I'm trying to make sure my hair is okay, right? and you know, I feel as though society is putting too much emphasis on roles and what's male and what's female and masculinity, femininity. If a guy talks with his hands, he's feminine, right? But the guys that I know, they're Italian and they all talk with their hands, right? That's what we do, right? But I just feel that if we just treat each person with love and pay attention and just receive what someone has to offer, just practice coming from a place of love, the world would be a better place.
Thank you, Javon. Thank you so much for that. I really appreciate that perspective that you bring, especially the experience of being in this world, right? And how this world sees us and really challenging that. I'm looking forward to us continuing to push for that. One of the things that we heard in the video too, and if you're thinking about, so I'm listening to all of these experiences and things that you all have to navigate and have had to navigate through your journey. And I can only imagine the amount of turmoil that has on you mentally. And that was an area that we also wanted to dive into to really understand. And just as what you mentioned, Javon, about, you know, be patient to that person, just be happy they got out of bed that day. You know, there's so much strength to getting out of bed. And I'm going to ask our other guest, Toni Barrington, to share a little bit about that experience that she's witnessed and been part of.
I really appreciate being here, and thank you. This is my first time at the summit. My name is Toni Barrington, and I'm an IT category specialist at Chevron. My partner, after about 10 years of being together as lesbians, came out to me and said, I'm not happy. I haven't been happy, and I can no longer live a lie. And told me I want to transition. It came as a shock to me at first, because we had been together for 10 years at that point. And I'm like, well, we started a nonprofit, and we were just like kind of in the thick of things in the lesbian community. But just to see him, once he was able to share with me how he was feeling, just to see what he was going through mentally, was enough to know that he was not only serious, but this was taking a toll on him as a person and not being able to live as his whole self. So after that, I will be honest, I was angry, because I had identified, and see, that's the thing with identity. When you take on so much of an identity, you make it your own, you make it yourself. It's in not realizing it's just a label, and this person that you love so much is hurting. So we came up with a plan of action, and he researches everything. He looks for everything. And at that time, I wasn't at that time I was working at another company, And I started researching with him, and he decided to start taking hormones. And I realized with that company, it was okay when they had him down as a domestic partner, but the insurance started to the insurance company rejected paying for his hormonal treatment. And so I realized that the reality changed some with regards to being domestic partners, same-sex relationship. So we made a lot of different choices, and one of the choices was we decided to move from at the time we were living in Texas, decided to move from Texas because as he was going through the hormonal therapy, he started his physical being stopped matching his paperwork. Stopped matching his documents. So we decided to move to California for a little while so he could feel comfortable doing the legal transitioning of his documents, his gender, changing his gender and changing his name. But for him to feel so uncomfortable being in Texas doing that, and there was a lot of reasons. There were a lot of judges that were known to be very difficult in Texas when it came to transitioning. So we went out to California for a little while, and he was able to fully transition paper, government, everything over. And later on, about almost 3 years ago, I joined Chevron. And when I joined Chevron, I saw how welcoming the environment was. And I also, one of the most important things, realized how Chevron has no problem with the health insurance side of paying for hormones. There's no question when it comes to the mental health side of paying, of them paying out claims for it when he goes to his therapist. So the journey for me, being at a company that really works on being more inclusive to not just be on paper, but for not only the employees, but for the employees' spouses and partners and things of that nature was very important. As well as we've been domestic partners since 2005, and Chevron honored the domestic partnership, and I didn't have to worry about submitting the paperwork to the HR rep that supports my team. The way that we do it at Chevron, we upload it and it's handled completely different. So when we sent in the domestic partnership paperwork along with his paperwork with his gender change and name change, that was handled in full confidence, and was able to add him and our daughter, which is actually his biological daughter, onto the health insurance. So to actually finally come to a company where as I could support him with good benefits, and him feeling whole and being respected as my partner and not just an additional insured.
All right. So one of the things, I guess, what we heard, right? We heard the experience. We heard a little snippets of how we can make a difference. And so what I'd like to do now is kind of dive in a little bit. And again, thank you, Tony, for sharing that experience. One of the things that I heard in the video, and let me just scroll to the next one real quick. So what we want to focus on as we keep diving in is what is it that you can do on a personal level? What can your corporation do? How can you guide your corporation? And then as an employee resource group, which a lot of them are here today, a lot of you represent your ERGs, what you can do. And the one about creating space, there was a quote, and I'm gonna ask Javon to speak a little bit more on this, that was in the video, and it said, "We don't need you to save us. We need you to give us the space to save ourselves." Javon, could you expand a bit on that? What does that look like?
Right. That was Renee. And so what that looks like is how Princess Janae Place came about, right? Um, we had a capacity building grant, and the capacity building grant gave us space to house our community, right? Instead of you doing it the way it hasn't been working, right? And the way Tori put it out there, two hookers and whores in New York already told you how to do it, open up an apartment and put the trans community in it and allow them to live, right? That was Sylvia Rivera and Marsha P. Johnson with the Star House. So it looks just like that. Give us the funding or give us the space, an apartment, a job, and allow us to flourish, right? You've already given us the guidelines, the rules, the regulations, and we know what's needed. Let us show you what we can do, right? Don't tell us what we need. We can tell you that. Just open the door and allow us to walk through it. That's it. Put us at the table. I'm being very transparent here. How many trans people are on the board or on a committee at Chevron, right? If there isn't, it's time to put one there. At the other jobs, for the people watching, if you want to hire us, you need to have us in these positions so that other trans people will feel comfortable to come and work there. Because if I don't see someone that looks like me, I'm not coming, because I'm not trying to be tokenized, right? And I just want you all to understand that we have the knowledge. We just need you to step aside. That's about it.
Anyone else would like to speak on that? I see Tori's hand.
Yes, so great. I'm loving all of this already. And I'm a note taker. So I think what many folks don't get, trans people, we are endowed with a lot of natural survival skills. We're just as smart as our non-trans peers and allies. And I think for many of us, what we lack are access and opportunities. I often tell stories about there are these two magical words, internships and mentorship programs. Those two magical words, intern and mentor, that again, this white, heteronormative, socioeconomic, cisgender ideal created for their cousins and their children who didn't have perhaps the book knowledge to get into or the educational credentials to get into jobs. They created these systems. They created internships so that other folks could come and work with them. It's on the job training. So we have to be very, very intentional at all levels of engagement to create paid internships. Thank you, Sloan. Paid internships and mentorship programs and opportunities for access for trans folks. And we have to be really, really intentional about that. I also wrote down, Javon mentioned having a seat at the table. Certainly that's important. It is incredibly important, and no one can deny that there needs to be trans people at every proverbial table in every boardroom across the country. And I will say, for those who yet don't have a seat or who have not figured out how to create a seat, at the very least, don't lock the door on us. Don't lock us out of that room. Allow us to create our own seat if necessary. And so that's important, because you can be an accomplice and you can be complete. Can I curse by head nod, Michelle? So you could be complicit in bullshit by keeping us out of stuff rather than including us stuff. Because there is a difference, Tony. You can not include us, but you can also be complicit in blocking us from certain positions and certain opportunities. And that's really important. And then I will also say this. So when creating seats and spaces for trans people and moving out of the way and also welcoming folks in and hand-holding trans folks into spaces that traditionally trans folks have not worked. That also means stop tokenizing trans people. Stop tokenizing us. And tokenism, you just like we talk about bias and we talk about microaggressions and all that other stuff, there can be tokenizing and there can be micro-tokenizing. You can say, oh, well, I didn't know. Well, that's a microaggression, and it's also a sense of tokenizing that comes along with that as well. And assuming that one trans person has to represent all trans people, that's tokenization, and it is rude, and it is disgusting, and it is dehumanizing, and all kinds of other adjectives that I can throw on that. So yeah, so there's that.
Yeah, no, and I'm really glad you all brought that subject up of tokenizing, right? So when I look at our workplaces, right, I feel that not necessarily all of our trans employees feel comfortable coming out, right? Sometimes you'll see that people will move departments after they've transitioned so that they can be either their authentic self and not have to worry about people knowing that they're trans, right? And I guess my ask of you all is, how do we make this workplace so that it's not even a question of asking, right? It's so comfortable that people just are themselves. And maybe you touched on it a bit about that gender fluidity and really changing that culture. And how do we do that? Because I want to see a diverse board. I want to see, people reaching out and being their authentic self, and not feeling like they're being put on a spotlight. Any thoughts on that?
Well, I have to say, from a perspective of being an employee at Chevron and having a partner who's trans, we had one person come out in our workplace. She's actually did her first year. She had full support of HR. She had full support of her leadership team. But to even have to get the support of everyone in order to transition in the workplace is unfortunate. Like, for me, my personal call to action is being able to give people what they need. And the trans community has been left out of the LGMB for so long that it's time to help as individuals working at companies to offer the mentorships, like Tori mentioned, to be the person that steps up and want to help mentor people so they can have viable employment. As we talked about with Tori before, it's about changing the mindset at the company, but that change comes with the individual and being willing to step up and take responsibility and say, hey, and accountability. Let me reach out to an organization and see what I can do to help bring people, start bringing people into the corporations, so that there can be viable employment. There can be employment with good benefits that you can have, not only take care of your physical well-being, but your mental well-being.
So may I add something very quickly onto that, Michelle?
Yeah.
So thank you for that, Tony. Thank you for what you were saying, Javon. And what you just said about the T is not part of the LGBTQ. That's my life. And I think Javon certainly, and perhaps your partner can ascribe to that as well. We've never felt a part of it. And the irony of it is that because of what happened at Stonewall 51 years ago, it is the reason that we have a gay rights movement today. Because of using today's terminology, two trans women, and more specifically, a Black trans woman, again, Marsha P. Johnson. So there's something with that. And I will add this as well. And so if y'all know how Black women, how we talk with our hands, I'm stereotyping here, but it's okay. When we talk with our hands, that means you're about to get some good stuff. So I will also say this. So Javon and I as well are consultants. And so I charge a whole bunch of money. I do this thing that is really more specifically for folks whom society deems as marginalized. And I charge a whole bunch of money for this. And it's called leveraging your tokenism. because society folks are going to tokenize you whether they intend to or not. You know, when you act, and there are all kinds of ways to do it. And so from an empowering standpoint, those of us who are on the end of that about leveraging your token, we have to figure out how to, because we got to navigate these systems. And so I empower people to make decisions that are certainly going to be best for you, but that are going to help the movement along as well. And so that's important. But then there's for our non-trans peers, it's also important. We have to, I haven't heard the word bias come up yet, but even the LGBTQ folks, there are a lot of folks, all of us as human beings, because you breathe, that you bring certain biases to the table. And so the first thing you got to do is own your shit. That's the first thing you have to do. If you have certain biases about trans people, own it. Own it. But the most effective people, the most loving and appropriate and caring humans, and the best co-workers are people who work beyond their biases, who are very, very intentional about, you know what, well, I thought all Black women were this. I thought all trans people were this, et cetera, et cetera. So many other things. But that's it for now, because I know time is running short. But that's really, really important. You got to own your shit. That's first. That's the very first. All of us come with it because we breathe.
So one thing that's been asked, I think we can probably do a quick definition, is what is tokenism?
You ask 50 people, you're going to get 60 different answers. I would say tokenism in many, many ways. Tokenism, and I kind of explained it. It is when your lived experience is different than everyone else's, and you can in turn be treated differently, usually negatively because of that. And tokenism and intersectionality are like first cousins, or like kids who have the same daddy but different mamas. You know, because intersectionality is all about the ways that you describe yourself. All of those commas represent an intersectional part of your identity. I'm Black, I'm trans, I'm a Southerner, I might have Caribbean parents, I like English might not be my first language, I might be an immigrant. So all of those commas represent different parts of your intersectionality. Tokenism is being the only one, or one of very, very few, and sometimes being chosen specifically because of that. Like just to have a trans seat at the table, that's tokenism. Now that can be, the thing is, when you use that again to your advantage and to the advantage, being a good opportunity, using it to your advantage and to move the forward movement for folks who are like you or have similar lived experiences.
I like that. I like how you
Yes, Morgan. Yes. Thank you, Michelle.
You're welcome. I know we only have about 5 minutes left. I have one more question I want to ask, but I do want to remind people to please provide some survey questions. There's some survey questions. Give us some feedback. Definitely, we're going to learn from that, and we'll try to respond to any questions you might have as well. So the topic that you brought up was intersectionality, and I see that as a very powerful, what I'm going to call a tool. So how can we use intersectionality, or what is the beauty of intersectionality to help us push forward with our companies, with our ERGs, and with ourselves? Oh, I'm going to open this up to anyone.
I think it's interesting, you know, if you look at the intersectionality, both as it relates to HIV and AIDS and LGBTQ and trans, you know, the AIDS crisis was just an amazing space of intersectionality. There were so many different movements that intersected in that particular tragedy. But out of that, there came an amazing amount of power and partnerships and alliances. You know, we had trans, we had women, we had poverty, we had homelessness, we had gay, we had access to healthcare. There were so many different movements that intersected in that one pandemic. And out of that, there ended up being a certain amount of commonality that we all sort of, to some degree, came together, fighting for our own needs, but then also trying to support others along the way. but I think it's also important to remember that in the struggle, and I'm going to be really honest and vulnerable, that in the struggle for gay rights, if you will, let's just call it the early days, I'm old, gay rights, I was on a call with one of my fellow EDs that we have this twice a month call with other LGBT EDs, and he runs the Oakland LGBT Center. And this was at the time when, right after George Floyd, and he said, I need to say to my white and Asian gay brothers and sisters, you left the Black community behind when you got your rights, when you fought for them. You did not bring us along because you were fighting for what you wanted, equal rights with your peers in the white community. And as difficult as it was to hear, it was powerful. So the intersectionality brings us together.
All right, so we have about 3 more minutes, and there's this conversation is just beginning, right? It's just beginning, and there's so much content in the chats where people want to talk and speak, and I'm guessing there's probably a way for us to continue this conversation via chat within Out and Equal, because I really want us to come up with these ideas and brainstorm and really institute it at our locations. Right, that's where we got to go from here. Right, this isn't the end. This is the beginning. And Tori and Javon for the White House. I'm all behind that as well. Oh no. All right. So with that, what I want to say is I want to allow our speakers to, if there's one thing you want us to walk away with from today, what is a sentence or two you want to share? And I'm going to open this up to everyone.
Okay, so I'm gonna go before Tori this time. Okay, because following Tori.
All right, we'll ask Tori to go last then. Okay.
Tori says everything that I felt like saying. Okay, so I want to say thank you to Chevron again for inviting us here, and I put in the chat where you can find this video on YouTube. So if there's one thing that I want people to take away from this is to treat people the way you want to be treated. We are all human and we all deserve love. That's it, period.
I love it, Javon. I would like to say the one takeaway from this, I really encourage those that are in organizations, corporations, to mentor, reach out to the organizations like where Javon has, that Tori has, and say, hey, I want to mentor a couple of people. Take on that responsibility, be accountable, and take that ownership, and help the next person come up. Let it be the universal law of reciprocation. You mentor someone so they can go out and mentor the next person, and so on and so on. So when those people do get a place at the table, people won't say, oh, they were the token. No, they came in with the experience. They had a mentor. Somebody brought them in.
Awesome. Again, thank you. Thank you again for having us, Chevron. I'll make this very, very brief because time is limited, but I would say do your part. We all have a part to play. I often use the McDonald's reference that everybody doesn't need to make fries. Some people need to be on that milkshake machine that breaks down every week. But let's do it. Let's say we work in a 5-star restaurant. We're comparing this to Chevron. Be a sous chef. That means if you need to chop vegetables, then that's your job. Do your role. Make sure that you're chopping up discrimination and really ridiculous hate speech. And maybe you're somebody that works in desserts, and desserts could be like accountant, because I happen to like a check. And so if that means paying people equitably for the work that they're doing. So whatever your part is, just do it, and do it for the right reasons, and do it. Do something, but doing nothing makes you complicit in the foolishness.
For me, thank you, Tori. For me, it's a matter of taking risks. We all go on vacations around the world and learn about different cultures, but we do not do that in our backyard. So my challenge to everybody, get out of your own bubble. Get out of your comfort zone. Reach your hand out to someone different, because it's in that act that we get to grow as human beings, and that we get to be better people, and that we get to move in the world in a more authentic and deep way. That's what life is about. We are human beings engaging with each other. That's what it's about.
All right, I'll say the last couple of words here, and I wish we had hours and hours more to talk. And it's funny, John, I was just thinking, like, you know, and something Tori said earlier, like, I'm completely comfortable talking about this, and I'm completely comfortable with everybody here, and I really enjoyed it. But I think one point is, you know, we're all different, that's fine, but we all have colliding points and connections and intersections that we should all be able to relate with. There's something we can all relate with. Sometimes you just have to find that amongst the person that you're talking to or engaging with or the organization. And I just say be open and listen and educate yourself and others. Thanks, Michelle.